just as in adults, the use of neuromuscular monitoring in children is quite sparse. The representative reports that have taken place show that only 30 to 40% of clinicians actually use the monitoring. And impressive is that the more experience they have, also the less monitoring they use. And as well, the more Sugammadex they use, the less the monitoring. So it's a bit of sort of reinforcement of the common pitfalls. What has also been observed is that high dose of neuromuscular blocking agents tend to lead to high post-operative pulmonary complications. The younger the patient, the shorter the surgery, and the higher the ASA grade, the higher these post-operative pulmonary complications tend to be. Also important to refer is that the younger the patient, and especially in neonates, the normal pharmacokinetic and pharmacodynamics of normal neuromuscular blockers tend to be way outside what we are able to model. And for example, Rocuronium on a high intubating dose can have a duration of up to 19 hours in a neonate. So that once again states the importance of monitoring. Neostigmine tends to be avoided by pediatric anesthesiologists because, of course, it has a bit of a bradycardic potential. Sugammadex has been linked a bit also to bradycardia, especially in the early clinical studies. However, the incidence has been later been shown not to be, for sure, not greater than neostigmine. And although, and it's still only approved for children over 2 years old, recent reports that show that it is frequently used off-label. And in fact, some clinical studies have for the approval of this drug for pediatric patients under 2 years are actually ongoing. Very important also, and this relates to the use of Sugammadex in women in fertile age that are using an oral contraception. In these patients, if Sugammadex is used, because it also tends to encapsulate the steroidal part that is given with the oral contraception, there is the potential that these women get pregnant within the first week after receiving Sugammadex. However, up to 40% of anesthesiologists never discuss this with the patient. Finally, in terms of anaphylaxis, there does not seem to be a different incidence rate when compared to adults.